Okay, now we have discussed a lot of the physiology, regulation, and function of sleep. Let's examine how these things change in older adults. First, there are biological changes that happens in older adults. So with aging, there is an increased corneal and lens opacities, which impairs the light and dark perception of the retina. This in turn weakens the signal that goes to the suprachiasmatic nucleus, and with some atrophy in brain structures, you end up with less melatonin released in your brain. Outcome is impaired process C. With aging, you also have decreased physical activity, decreased social activity, decreased mental activity. All these indirectly affect the brain metabolism and the accumulation of adenosine. You're not using as much ATP in your brain as you used to in the past. And the net outcome is impaired process S. So you have a weaker circadian clock and a weaker sleep drive. That will lead to some cycle changes. So these cycle changes include outcomes of impaired process C and process S. You have a harder time falling asleep with increased sleep latency. You see insomnia, you see frustration, you see delayed phase of sleep, maybe daytime naps to make up for it, and possibly worse quality of life. You also see neurodegeneration, especially in the cholinergic system, causing decreased REM sleep and decreased N3 sleep known as the slow wave sleep, which cause more N1 and N2 cycles relatively, incomplete sleep cycles, more superficial sleep because the more you stay between N1 and N2, you're closer to wakefulness. Makes you very liable to awake if anything interferes with your sleep, like cold temperature, noise, unexpected light. You get fewer sleep cycles, and you get decreased overall sleep efficiency and decreased sleep awareness. So you get your quantity and your quality of sleep impaired. Okay, now let's take a moment here and examine our biases. So one can say, of course, he likes soccer. It's the most famous sport in the world. That's an easy guess. However, one should not say, no wonder she cannot sleep, she's a gazillion years old. Because what we had discussed applies to most older adults. However, the degree of change for every individual may vary dramatically. We still see patients in our clinics in their late 90s having excellent sleep.